So I'm Alexander Perl from the University of Pennsylvania, and I'm speaking to you live from the ASCO meeting in Chicago in June of 2017. And I was invited here to speak about the Trials in Progress abstract from the Admiral study, which is a pivotal phase 3 trial of gilteritinib, or ASP2215, versus investigators' choice of salvage chemotherapy for first relapse or primary refractory FLT3 mutated AML. This study follows on the heels of a phase 1/2 evaluation of gilteritinib, which is a highly selective and potent FLT3 inhibitor that was tested and showed a high response rate in relapsed and refractory patients with FLT3 mutations and very limited efficacy in patients who did not have that mutation, suggesting that in the clinic it's really quite selective in its activity against the FLT3 mutation. The drug on the phase 3 trial that I'm presenting is being compared against investigators' choice of salvage chemotherapy. There are 2 low-intensity choices and 2 high-intensity choices that must be selected prior to randomization. Patients can receive low-dose Ara-C, 5-azacitidine, MEK chemotherapy, mitoxantrone etoposide, and high-dose cytarabine, or FLAG-IDA, fludarabine, Ara-C, idarubicin. And this is selected prior to randomization, and patients are randomized 2-to-1 to the FLT3 inhibitor versus the investigator's choice of chemotherapy. They're then followed for not only response, but importantly, survival. The primary endpoint of the study is an overall survival endpoint. The study looks to enroll 369 patients, and the study will be complete when there have been 258 deaths on study. There was also a planned interim analysis at half the projected events for the study, and that may actually happen relatively soon. So we hope to have information regarding results on the study within the year, which will be exciting for upcoming meetings, of course. Progress has been very good on the study, but obviously we're looking for more subjects to come on. There have been over 220 patients enrolled to the study as of this meeting. So in terms of the tolerability of gilteritinib, it's been a very well-tolerated drug with a high response rate. It has been active in patients who have resistance mutations to other FLT3 inhibitors, and it has not emerged as a drug that has significant toxicity concerns in terms of significant risk of QT prolongation or profound myelosuppression or significant GI disturbances, though we can see some side effects of GI disturbances or elevated hepatic transaminases with the drug. In general, it's been very well tolerated, and we give it as outpatient therapy. It's a once-a-day oral agent. And we hope to have more information at future meetings.